Welcome friends, family, faculty, staff, leadership, distinguished guests, students, and graduating students. I'm Linda Peffley-Fear, Associate Dean of Nursing at Piedmont Virginia Community College. Thank you for joining us today at PVCC Nursing Pinning Ceremony for our May 2023 ADN or Associate Degree graduates. This group of graduating students are pioneers. This group of graduating students are survivors, with and without caffeine. Okay. This group of graduating students are examples of true resilience. Florence Nightingale, Our Lady with the Lamp, whose birthday we celebrate today, would be very proud of what you have accomplished, especially during a pandemic with many obstacles, including scheduling, location changes, well, let's just say changes daily, right? Our pinning ceremony is rooted in tradition, as our program this afternoon will explain. We are so happy you all are here to share in this tradition with us. Let's begin with a few words from Dean Nicole Winkler.
Good evening, everyone. My name is Nicole Winkler. I'm the Dean of Health and Life Sciences here at PVCC, and I can say with absolute enthusiasm that attending the pinning ceremony of our health program graduates is my favorite part of the job. Seeing the graduates smiling, often with relief, that they've accomplished their goals is one of the most rewarding parts of my professional career. Many of the graduates here tonight may not know this, but not only am I a health and life sciences dean, but I am also a licensed radiographer by trade. A radiographer is a healthcare professional who takes x-rays and other medical images to assist doctors in diagnosing disease and injury. However, a nurse, unlike a radiographer, spends a lot more time with their patients, ensuring their comfort, administering medications, and providing advice and emotional support to patients and their families. So tonight, or today, it's not tonight, feels like tonight, I want to take this time to share a personal story about an encounter I had recently with some extraordinary nurses. Last summer, my 11-year-old daughter came home with a stomach ache. We didn't really think that much about it at the time, figuring she just had a virus, but most tummy viruses only last 24 hours, and my daughter seemed to be steadily getting worse over several days. Within 2 days, her fever was progressively rising. Then she couldn't walk, and she was in excruciating pain when we touched her stomach on the lower right side. As a healthcare practitioner myself, I knew that pain of that kind in the lower right quadrant of the abdomen was a telltale sign of appendicitis. So we rushed her to our local hospital in the valley, and after a CT scan, they confirmed that not only did she have appendicitis, but her appendix had ruptured, and it looked like it had been that way for a couple of days because the poison from the appendix that erupted into the abdomen was so extreme that it had already caused an ileus, which is a condition in which the bowel just stops working, almost like a blockage in the intestines. So she was rushed by ambulance to UVA Hospital for emergency surgery. And as you can imagine, my husband and I, along with her 2 older brothers, were scared beyond all reason. So because her appendix had ruptured, she spent 5 days at UVA Children's Medical Center, enduring multiple needle sticks, doctor visits poking and prodding at her surgical site, being woken up every couple of hours during the night for vital sign checks, and more. However, if you ask her today about that experience, she doesn't really remember any of that. What she does remember is her nurse, Becca, who spent countless hours comforting her, reassuring her that she was healing, and the innumerable number of other nurses who cared for her, to include LPNs and CNAs. Even today, whenever we have to go to the doctor's office, even for a well visit, she asks if Becca works there. And so that is the profound difference that a nurse makes in the life of their patients. It was that overwhelming imprint that Becca made on my daughter during one of the worst, most terrible experiences of her life. That is what nurses do. Every graduate today who will be coming up to receive their pin tonight should know that being a nurse is so much more than an art and a science. But at its heart, nursing is a fundamental respect for human dignity and a natural intuition for a patient's needs. Lastly, I'd like to share a quote from one of my previous students, radiography students that is, which still profoundly resonates with me regarding the field of healthcare. As an offering of criticism for a research paper, this student offered one of the best sentences of critique that I've ever heard to one of their peers. They said, "What difference does all the healthcare in the world matter if you forget the human story behind the person you're caring for?" After all, it's about getting the family the information and diagnosis to move forward in life. So with that, graduates, I want to offer you my sincere congratulations. You have my greatest respect, and I know without a doubt that each of you will make a difference in the hearts of your patients. And I look forward to seeing you walk across the stage tonight and this evening during the commencement ceremony. Congratulations.
Thanks, Nicole. Now we will hear from two student speakers, Demir and Anton.
Thank you so much. Hello, everybody. This is admittedly nothing like practicing in a mirror, I will admit. My name's Demir. I've been part of the day cohort here. Hello, day cohort. With the time I've got here, I'm just gonna attempt to share what an extreme position of privilege I've found myself in for the last couple of years, to count myself amongst the rank of some of the strongest, kindest, and most brilliant people I've really ever met in my life. I'll kind of like to start that off by thanking all of our families, all of our friends for coming out, showing us love, showing us support. Without my support system over the last couple of years, well, I wouldn't be standing here, I'll say that. And I would also like to thank you all for your roles in shaping these people into the wonderful people they are today. I'm not a parent, but you all did a splendid job with that. I'd also like to thank all of our professors over the years. You know, I know it's not been easy to adjust to some of the challenges that have been thrown your way and our way in this kind of hopefully fizzling out COVID era. But your efforts to mitigate those challenges and mitigate the effects of those challenges really have not gone unnoticed. And my classmates have been, I will say, borderline harassing me to give special thanks to Professors Faisant, Panic, and Zanzal for pushing us through this very last semester here. So thank you all so much as well. And to my classmates, I can't believe I get to say this out loud, but here we are, and we've really finally done it. It hasn't felt real to say that until I will almost say this very moment, to see everybody here. It feels surreal. And nursing school hasn't been without its challenges for us, without its complications and hardships. There have been certainly times where everything felt stacked against us. Times we pulled out our collective pitchforks in class to demand answers. So thank you all again for dealing with that. I do like to think, however, that with all of those hardships, they've been the building blocks for building some really strong bonds and relationships amongst ourselves. So I wouldn't trade it for the world, and I'll just say it's been a overwhelmingly net positive experience. And I'm really, really, truly, from the bottom of my heart, grateful to have had each and every one of you in my life for the last couple of years. I couldn't have done it without my various chat groups where I get to vent my frustrations and get to hear all of yours as well. I suppose our next big hurdle will be the NCLEX. And valedictorian may be inclined to give you advice on how to handle that, but I'm not the valedictorian. And they'll vouch for me when I say you do not want my test-taking advice. So instead, in my vast research over the last couple of years of how to write a graduation speech, I've noticed this pattern of quoting a great philosopher or a celebrity as a means of giving advice. However, I find that these people, they have a couple of profound bits of advice or quotes in a lifetime of very questionable choices and other quotes. So instead, I would like to share the advice that I have gotten over the years from a person I know is absolutely perfect, and that's my lovely wife, Gina, who might kill me here, but who would frequently sit by my side and read over my shoulder as I would struggle my way through the various practice quizzes and tests. And when I would answer something incorrectly, she would advise me with the following words, and I quote, "Dude, just read the question. It's not that hard." So thank you, Gina. I hope that helps you all. Thank you so much for listening to me, and congratulations again.
Good job, man. Right on. Thank you, Demir. My name is Anton Klepak. I was in the night cohort with a bunch of lovely people, only about 20 people, so not as many as Demir was with, but we still had a good time. I'd like to thank each and every one of you for being here for this tremendous achievement. I'd like to thank our wonderful faculty and staff, all of our professors. I'm trying to get us out of here quickly, so I'm not going to name everybody, but I know you have all put in countless hours and tons of hard work just to get us here. So we are finally here, and that is awesome. While I'm on the topic of hard work, I know for a fact everyone in my class has put in a profound amount of effort, from countless hours of studying to the 500 clinical hours we had to experience to get here. It was a lot. I started nursing school back in the fall of 2019. I ended up quitting in the spring of 2020 because of COVID. They canceled clinicals. And I didn't know how I was supposed to learn how to be a nurse online. How was I supposed to learn how to put an IV in someone's arm on the internet? Don't worry, I watched a YouTube video. I've stuck an orange. I got this. I'm a professional. It's okay. I contemplated coming back. I almost didn't. But I'm so glad I did. And I know many of you in my class that have had similar experiences where class just didn't work out at the time. But you came back and you finished strong. And I commend you for that. We worked hard. We went through a lot. We wondered if we would get any clinical hours during 170 when we were going through all of our staffing issues and clinical site issues. We were in the land of the unknown. To listening to the forever long lectures about mental health and beginning to think we might have mental health problems of our own. And to wondering how we all managed to fail that test on mental health. We did make it. We may not have been smiling in the face of adversity, but we had a few unsavory words with it. There were times that we felt graduation was never going to happen. The mounting anxiety for the next test, even though we just took a test. The talks of backup careers in case this whole nursing thing didn't work out. I was going to be a truck driver. And the threat of not being able to attend clinical because of our tuberculosis paperwork not going through properly. That was the biggest pain. But we overcame all these hurdles, and we finally saw that the light at the end of the tunnel was not a train. After all this, I have the utmost confidence in all of you to pass the NCLEX on the first try. There's not going to be a second try. You got this. You definitely have this. I think so. And I know we're going to provide the best nursing care to our community. And just remember, when we get our first job, there will be times where we think it's too stressful. There will be times where we think that we're just not cut out for it. And we will definitely be embarrassed when we don't know something that everyone else on the unit knows is common sense by now. But we got it. When those times come, I want you to remember the times that we experienced in nursing school together, and I want you to remember that you did make it through the trials, and we did make it. It was an honor working alongside of all of you. I look forward to working with all of you as coworkers in the hospital. If I don't see you there, that's okay. And I also look forward to caring for our families that may end up in that hospital bed. I will give my all, and I have faith in all of you to do the same. Thank you very much.
Thank you, Anton and Demir. Well done. Well done. Next up is our keynote speaker, President of PVCC, Dr. Jean Runyon.
Good afternoon, everyone, and welcome again. The faculty, instructors, and staff of Piedmont Virginia Community College are among the best. These individuals demonstrate a commitment to teaching and learning excellence, and they enrich lives through learning daily. This is also National Nurses Week, so I would like all of the faculty and staff of Piedmont Virginia Community College and any nurse who is in the audience to please stand and be recognized. Thank you. Individuals who achieve the highest standards of excellence often note that their achievement is due to the support of others who inspired and encouraged them along their journey. I asked our nursing students who inspired them to become a nurse, and the answers varied. My husband, my friend, the loving nurses at the Cancer Center at Martha Jefferson, my late mother-in-law, my daughter. Two mentioned their mothers, including one who was a nurse. This student shared, "She is no longer a bedside nurse, but I run into people all the time who remember her being their nurse. They always share how grateful they were for her or how kind she was to them." Nursing students, today we are here to celebrate you and your accomplishments and to welcome you into the nursing profession. Each of you bring an original story, important experiences, unique perspectives, and amazing talents. Your reasons for choosing to become a nurse varied, but each reason was heartfelt and inspiring. The reasons included to bring comfort, peace, and safety to anyone in need, to better community health and medical communication for all patients, to bring a greater purpose into my life, because the nurses at the Hope House at Martha Jefferson Hospital were so caring and passionate. I want to be a nurse like them and help patients feel and get better. As H. Jackson Brown Jr. stated, never give up on anybody. Miracles happen every day. You will be part of many, many everyday miracles. You will be there for your patients in the best of times, the birth of a child, or when someone finally gets to go home from the hospital. You will be there in the most tragic of times when every moment counts to save a life. You will be there in the saddest of times when all you can do is listen, comfort, and console. And you will hear, "Thank you, nurse, for the little things you do for your patients." Even seemingly small gestures will move and soothe the human heart and spirit. Each of you will touch lives and hearts every single shift, and each of you will be a healing influence in the world. On behalf of all of us at Piedmont Virginia Community College, thank you, nurses.
Thank you, Dr. Runyon, and happy Nurses Week, everyone. My name is Ashley Hart, and today I am stepping in for Professor Cook-Riddle, who could not be here. I will be discussing the significance of the nursing pin. The completion of your degree is something to celebrate, as you will with your peers and other disciplines tonight at graduation. But this ceremony, called the pinning ceremony, represents something unique to nursing, something near and dear to our hearts as nursing educators. So why a pin? In 1855, Queen Victoria presented Florence Nightingale with a pin for her service in Crimea. It contained the symbol of the Maltese cross and the words, "Blessed are the merciful." In 1880, the first nursing schools awarded pins in the United States were earned by graduates at Bellevue Hospital School of Nursing. Other schools of nursing soon followed, each designing their own unique pin. Nursing established itself as an independent academic discipline. The pin represented the knowledge, skills, and dedication of the new nurse entering the profession. And this was long before nursing was it was even socially acceptable for women to obtain a college education. In 1974, the first graduating classes at PVCC designed the pin. It contained the emblem of the college, encircled by a ring of gold, symbolizing worthiness. No one knows what it's like to go to nursing school except people who have done it. It's more than a degree. The pin means you have endured and prevailed through many challenges. The pin means you are ready and able to enter a profession with a rich history and an exciting future. The pin says, "I am a PVCC nurse." Wear it with pride. And now for the presentation of your very own pins.
Thank you, Professor Hart. I'm Professor Turner Miller, and I'm honored to be reading student dedications. First is Carmel Bartels. I dedicate my life's work to Jesus Christ, who gave me his spirit to guide me. When I'm weary and tired, his spirit revives me. In the trenches of nursing school, I saw my weakness and my strength was crushed, so Christ became my crutch and strength and trust.
Molly Becerra. I want to dedicate this achievement to my grandparents and my husband. For all of your love and support, I cannot thank you enough. I would not have made it this far without your guidance and motivation. This one is truly for you.
Sarah Bedford. Huge thanks to my husband and kids who have been so supportive of me starting a new career in midlife, and my amazing smart classmates who kept me laughing and on track with countless texts, and to the professors who cared about helping us become great nurses. I'm forever grateful.
Kara Boyle. I'd like to thank my family for supporting me, my friends for keeping me going, and my teachers for allowing me this opportunity, but I'd also like to extend a special thank you to my capstone preceptor, Ann Liskey. Without you, I would not have the confidence I need to begin my nursing career.
Julia Buczynski. Thank you so much to my wonderful family, roommates, and friends. I am so thankful for your love and support.
Ashley Burheit. I would like to thank my loving fiance for putting up with me through this journey and always being there for me. Thank you to my mom, friends, family, and coworkers for being my biggest cheerleaders. Lastly, I miss you, Gramps. I finally finished.
Amy De Silva. Amy would like to thank Chad and Anna Clara for enduring the journey through nursing school alongside her. She'd also like to thank all her other family and friends who supported her during the past 2 years, making this graduation possible.
Liesel Emerson DeLang. I would like to dedicate this to my mom, who let me practice all my head-to-toe assessments on her and got me through every single semester. My sister, who helped inspire me to follow her footsteps into the nursing field. Frank, for always supporting me. And my cat, Pico, who never judged my mental breakdowns each week.
Zaina Dukan. If at first you don't succeed, try again. I would like to thank my friends and family for their love and support during this journey. Jackie, I hope I'm making you proud. Finally, Zaina Dukan, RN.
Jessica Dubuque. I am dedicating my pinning to my mother and my aunt for being the most amazing women in my life, and to all of my friends who stuck with me through this crazy journey. Thank you for all of your support. I couldn't have done it without you.
John Elliott. I would like to dedicate this milestone to my talented and beautiful wife, Heather, and our boys, Parker and Davy, for supporting me through nursing school and also our support system. I could not have done this without you all. Special thanks to our professors for making this happen during COVID. I appreciate you all.
Elise Eppard. These past 2 years have been full of hard work and dedication, but now we can say we made it. I want to thank my siblings, boyfriend Toby, best friend Shelby, and most importantly, my mom and dad. Thank you for believing in me when I didn't believe in myself. I'll always be thankful for your love and support.
Brooke Falwell. I want to thank my parents and friends for their amazing support throughout these past 2 years. I truly could not have made it through this program without them.
Taylor Fields. I'd like to thank my parents, my family, and my dogs for all the love and encouragement during nursing school. I couldn't have done it without you guys, and I will be forever grateful for the opportunities you have given me.
Maggie Fulcher. A big thank you to Julius and every one of my family and friends for never letting me forget that I'm loved, supported, and capable. Another to my peers whose collective tenacious spirit kept mine afloat. And lastly, to the professors and staff who believed in us. Hugs and love.
Neve Gallagher. I would like to dedicate my pinning and journey to nursing to my cousin Alex, who taught me the meaning of perseverance and the difference that a healthcare worker can make for someone. I would also like to thank my parents and family for their continued support throughout.
Seth Golkar. It has been a long few years. Pretty glad that it's over. Thanks to everyone that played their part, especially Kelsey and Bear. I hope this is the first step for us all and we continue to grow for ourselves, for our families, and for our patients. Hashtag blessed.
Skylar Hall. I would like to thank my husband for always supporting me and encouraging me. Thank you to my parents for always believing in me. Finally, thank you to the healthcare professionals in my family, Cindy, Mark, and Nelson, who inspired me to pursue this career. Congratulations, class of 2023.
Mackenzie Harry. I dedicate this degree to the woman who is always taking care of those around her and inspired me to want to do the same, my mom. And a special thanks to all my friends and family who have shown me unconditional support.
E. Huang. Thank you to all the programs, teachers, and preceptors, my chemistry professor, Francis, who recommended that I work in the tutoring center, and all the classmates, especially Carmel, Carson, Natalie, Seth, John. Not to forget my aunt, thank you for being here. Without her, I wouldn't have had the chance to be here.
Katie Hughes. There's so many people that I dedicate this pen to, but unfortunately I can't name you all here. I dedicate this pen to my family, my husband who has supported me from the start, and to my children who should know it's never too late to follow your dreams.
Andrea Johnson. I want to thank my kids for pushing me to want to be a better me, my husband for supporting and guiding me through this whole experience, my sisters for always giving me the never give up conversations when I thought things couldn't get worse. Thank you, I love you all.
Catherine Jonte. I am dedicating my pen to my father, who lost his battle with cancer a couple of years ago. His passing inspired me to want to help and be there for others when I couldn't be there for him. I want to thank the PVCC nursing staff and all my professors for teaching and helping me achieve my goals through this journey to become a registered nurse, and to the friends I've made. I could not have gotten through this program without you guys. I also want to send a special thank you to both my mom and sister for financially and emotionally supporting me while I was in school. I could not have done this without you. And I'm so grateful and blessed to have you both in my life.
Damir Kayan. I want to thank my wife, Gina. Your love and patience has been all that kept my head on straight through school and work. Thanks also to Mama, the Marvins and Mans, Goran, Dino, and Camille for all the love and support you've shown me along the way.
Anton Klepak. I'd like to dedicate my nursing education to my father, for without him, I would never have considered becoming a nurse, and without his support, it would not have been possible.
Christopher Crutchin was unable to join us today. Next is So-Rae Lee. I would like to thank my family who are in distance but always supporting and showing love to me, my boyfriend who is also my best friend, my friend Rachel, Professor Panic, Moore, Agahawa, my awesome colleagues and friends, April, Sarah, Seth, Lori, Julia, and Taylor.
Sarah Lesich. My family and friends, work friends, and my daughter, who I breastfed during all the Zoom classes during the pandemic. She should get a pin also. To me for pushing myself when I wanted to stop during the loss of my mother and my grandparents. To my mother in heaven, who would be so proud of me. Also, probably my therapist.
Hannah Lilly. I would like to dedicate this pinning to Elizabeth and Richard Lilly, Anthony Rich, Joe Lilly, Sammy Cunningham, Fiona Jones, Danielle Phillips, Irene Agahawa, Romantha Turner Miller, Wendy Diment, Lorraine Collins, Dr. Farid Udine, Jason Panic, Tammy Zanzel, and Dean Linda Peffley-Fearer. Thank you all.
Marie Lauder. I'd like to thank my mom, Elma, for her love and for always being there for me, Anne and Penny for their kind gift, Dave for his generosity and opening his home to me, and Kyle and my cats for supporting me through all of my stress-induced emotional breakdowns.
Carson Lowe. I want to thank God, my parents and family members, my preceptors and educators, and my friends that have all supported and encouraged me along the journey of becoming a nurse. I am also grateful for the patients that have inspired me along the way.
Kristen Lucas. This would not have been possible without all of the strong women in my life supporting me, encouraging me, and always asking how things are going. To my mom, Karen, my grandma, Edna, my wife, Christina, and my mother-in-law, Kathy. Thank you.
Kyle Luke. Lighten someone else's burden, and your own will lighten twofold. To my amazing parents and dear friends, colleagues, and nursing community, thank you for being my support throughout this journey. I dedicate my accomplishments to you all, past, present, and future.
Skylar Lynch. To my parents, my grandparents, my boyfriend, Dom, the Stanzione Education Fund, and, well, pretty much my whole family. Your love and support have been an invaluable source of motivation. A big thank you to my classmates. Without you guys, I probably would have lost my mind, and I'm forever grateful for the friendships made here.
Wyatt Mahanes. I'd like to dedicate this pinning to my amazing family and loved ones who have been there and supported me every step of the way. Judy, 15.
Josiah Mansfield. I would like to dedicate this journey to Tom, Steve, my family, and myself. Thank you to my cheerleader, Jay, and my friends who kept me going. Thank you to Professors Jason Panic and Ramantha Turner Miller who believed in us. It took a village and some prayers, maybe wine, but we made it.
Nikki Marshall. Thank you to my husband Daniel and our families for their encouragement, love, and support. To my sons Ethan and Jace, you two are my motivation every day to be the best that I can be. Thank you all for believing in me and cheering me on. We did it.
Amanda McLeod. I'm dedicating my pinning in memory of the late Flora Green, my dearest nurse friend. Thanks to my mom, Jeanette, my two wonderful kids, Ashton and Lacey, and Corey, for supporting me through this journey.
Jessica Meeks. Thank you to my family for supporting me through nursing school, especially my sister who showed me the ropes of nursing. Can't wait till we get to deliver babies together in July. The biggest thank you goes to my fiance for being the best support through all of it.
Cole Moore. I want to dedicate this to all my friends and family who helped me through this bumpy road in one piece. There's one who stands out high above the rest, though, Barbara. If it weren't for your example, I'm not sure I would have made it this far.
Anna Marie Morris. I would like to thank my mom, Marcus, my dad, Caitlin, Maddie, and Teddy for always believing in me and supporting me. I would also like to thank Blaine and Brett for keeping me sane, mostly. If nursing school did one good thing, it was giving me my best friends.
Natalie Murphy. I owe an impossibly large thank you to my family for their unwavering support and encouragement while I was in this program. I also want to thank my friends and classmates. Without them, I never would have been able to make it this far.
Madison Myers. I dedicate this pinning to every person who has cooked me food when I haven't had the time to feed myself. Thank you to my family and to my fellow classmates and supportive professors. Thank you to my little sister Nan. You are the first reason I wanted to take this path.
Allison Payne. I dedicate my nursing degree to everyone that has dealt with me during finals, the nurses that have answered all of my questions and made me the nurse I am going to be, and my partner for always supporting me through everything. You are the best thing that ever happened to me and are always supportive of every life move we make together.
Kristen Perkins. Thank you to my family who has always been there throughout this entire journey. I'm so grateful for their love and support along the way. A huge thank you to my very patient and loving husband, Matthew. You encouraged me during the toughest times and never failed to give me the best pep talks. Much love.
Brett Philpott. I would like to thank my wife, children, Anna Marie and Blaine, whom without I wouldn't have made it through. I would also like to thank all of the rest of my friends and family, as well as the nurses that I worked with that encouraged and helped me to get through the program.
Anadeli Piedra. First, I want to thank my husband and family for supporting me through these past 2 years, especially my husband for putting up with all the tears, tantrums, and sleepless nights. You are the real MVP. Second, thank you to all the professors that helped us along the way. You know who you are. Lastly, I want to congratulate my classmates. I'm so grateful I got to meet some amazing people in the program. I will never forget the fun moments we spent together. We finally made it. Now let's go save some lives.
Catherine Pontani. I dedicate this pinning to my husband, Joe, and our wonderful daughters, Harper and Rose. Harper and Rose, thank you for being my constant source of joy and inspiration. Joe, I could not have done this without your unwavering support, encouragement, and love. Thank you for always believing in me.
Adriana Potter. Thank you to my mom and dad for the constant support and love, my siblings for being my inspiration, my nieces and nephews for influencing me to become a pediatric nurse, and all my friends I have met and made along this journey. I love you all.
Reina Rauda Miranda. I want to dedicate this achievement to my sweet daughter for being so patient and for demonstrating such sense of understanding during this journey, to my wonderful mother for her unconditional and endless support, and to all of those who had words of encouragement for me and always offered a hand.
Olivia Richards. This pinning is dedicated to and for Nikki, Reflection Light, Linda, Perspective, Beverly, Counsel, Parents, Foundation, Dr. Richardson, Grace, Dr. Allison, Potential, Eamon and Florence, Fortitude, Step Forward, Strides, Amanda, Connection, LT, Advocacy, Panic and Zanzel, Patience, Dean Peffley Führer, A Second Chance.
Patrice Ross. This pin is dedicated to my family for their love, support, and for pushing me into purpose. To my children for being my biggest cheerleaders when I wanted to give up. To my colleagues for your support and encouragement during this time. It takes a village. Thank you for being my village.
Blaine Sandridge. I'd like to thank my parents and sister for their guidance and support. I wouldn't be where I am without you all. I'd like to thank my best friends, Anna Marie and Brett, for getting me through nursing school. Thank you, Hillary and Marcus, for teaching me what nursing school didn't.
It looks like you've got a double.
Okay. Yes, we are. It's okay. Just a little hiccup.
Yeah. Where did you leave off?
There she is. You missed a paper. Congratulations, Sarah.
Okay. Sarah Schwagerl. Thank you to my mama, dad, sister, Sally, family, and friends for all the love and support. To quote the poem Footprints in the Sand, God loved and carried me through past trials and never abandoned me. It is the end of a beautiful journey, and the beat goes on.
Ozzer Selemitich. I would like to thank my family, friends, and dogs for all their love and support over the last few years. Thank you to Kate, Mustafa, Berkey, Vito, and the Selemitich, Zvonik, Speakerman, Young, and Carriol families for all the delicious meals and unlimited coffees over the semesters.
Caroline Shepard. I dedicate my penning to my loving family, the ones who have supported me through thick and thin, fueling my crippling Celsius addiction, and listening to me talk to myself for hours the night before an exam. This is little Lonnie's dream, realized thanks to you. I love you.
Andrea and Jimmy Stanley. We would like to thank our family and friends for their love and support. April and her family, thank you for the times you cared for our girls when we had class. Most of all, thank you, Olivia and Emily, for your patience as we had to study and couldn't spend all of our free time with you. And Jimmy says ditto.
Ashley Steele. I dedicate my practice to my patients. All glory goes to God for the grace and means to fulfill my greatest hope. I thank my friends, my mother, and my brothers and sister, as well as my baby niece, Renly, for being freaking adorable. Also, shout out to 16L. Thank you.
Shelby Tidwell Rollins. First off, I want to dedicate this pinning to my Mimi and Pawpaw. I wouldn't be in this position without you two. I owe it all to you guys. I can't thank you enough. I also want to honor my boyfriend Joel. Your patience was everything I needed. The dramatics were on full blast these last 2 years. Lastly, I want to thank my best friend Elise. We got each other through this program together.
She's not here.
Lori Turner was not able to be here. You want me to do Nicole?
Nope, it's mine. Nicole Ulikas. I would like to thank my family, especially my parents and Jacob, for supporting me throughout the nursing program.
All right.
April Wong. A whole host of people have supported me throughout this long and arduous journey. Each and every one of you have my heartfelt thanks and unending gratitude, as I would not be standing here today without you all. I'd especially like to thank Billy, Elizabeth, Maggie, Ming, Patrick, and Soray.
Andrew Weldon. I would like to thank family and friends for all the support.
Jocelyn West. Thank you, Aaron, for supporting our family while I made nursing school my job. I'm proud to show our girls that they can do anything in any order that life takes them. Lastly, I wish you were here to see this, Dad. That PVCC pamphlet you got me finally paid off.
Natasha West. This pinning is dedicated to my fiance and kids for the many sacrifices that they have had to endure. Thank you for believing in and supporting me on this journey. Thank you to my parents, professors, and fellow nursing students for all the guidance and wisdom bestowed upon me.
Tori Wilson. Special thank you to my partner, Casey, best friend, Anna, and my sweet Shih Tzu, Lou, for staying by my side and believing in me throughout nursing school. And thank you to my parents for shaping me into a strong, resilient woman. I'm excited to join my TCV ICU family as a nurse.
Last but not least, Elizabeth Wittig. From the bottom of my heart, thanks to my parents, siblings, Papa, Nana, Nanny, and Grandpa. You are all my biggest cheerleaders in life and up in heaven. To my dear friends on stage with me today, we got to start and finish this together. What a blessing. I am endlessly grateful for all of you.
This is a pinning and award ceremony. So here comes Professor Wendy Diamond.
And Dr. Uden. All right, so the first award that we're going to present today is for the highest GPA in nursing, which is quite an accomplishment. It is with great pleasure that I present today's award for academic excellence with the highest cumulative grade point average. This is a remarkable achievement. This award signifies that the graduate nurse I'm about to announce is exceptional. She has committed to the pursuit of a professional career and, while overcoming immense obstacles, excelled in a very challenging program, as you guys know. It is indeed a remarkable accomplishment to achieve this recognition. A true story from Professor Panic. 2 years ago, I was getting ready to start my second year as nursing faculty. Before the start of the semester, I was in a new office and going through junk. A student shows up at my door with a literal list of questions. Apparently, she was on her way to or from the bookstore and decided to stop by and see which faculty members were there. If I recall correctly, she may have had a child with her. I was completely flustered and answered the questions inadequately. The point of the story is that the questions from the students started before they even began the program and haven't stopped yet. Maybe that's how they earned this award. Curiosity did not kill this cat, but propelled her to the top of the nursing class. Congratulations, April Wong. This was a hard-earned and very well-deserved award. Do you want to go ahead and have it right?
Congratulations, April. Thank you. Thank you.
Our next awards are for clinical excellence. This award is given to 2 graduates who have demonstrated the highest level of achievement in the clinical setting. These graduates were chosen by the nursing faculty and clinical instructors as having demonstrated the most personal and professional growth throughout their clinical rotations. Clinical excellence encompasses working compassionately and competently with patients, their families, and all members of the healthcare team. In addition, they demonstrated proficiency in clinical skills. The graduates who will receive this award tonight truly encompass the highest standards of accountability and professionalism that we expect of all of our students, and they have proven themselves to be role models to their peers. Our first award will be going to Catherine Pontani. So here is what her professor says about Catherine. Catherine enrolled as a first semester ADN student in the fall of 2021. She was noticed by her instructor in the Nursing 106 labs for the first 8 weeks in identifying her as one of the best students in the cohort. In spring 2022, Catherine was again in the Nursing 170 Med-Surg clinical under the same nursing instructor. The instructor had to review a great deal of material with his 10 students in a clinical setting at 3 Central for Nursing 170. And it was his pleasure to watch them become more knowledgeable and confident in their nursing skills. He got to know those students' strengths and their desires to become devoted nurses in the future. Catherine, in particular, was an exceptional student. Catherine is a mother of 2 very young girls, and despite her children's various sick days, the nursing faculty noticed how she made sure to meticulously complete her missed assignments and catch up on material in a timely fashion. She's very focused on her work and displays great analysis of medical learning during her presentations. With her permission, the instructor from Nursing 170 asked Catherine to share her notes from the clinicals for future students so they could perform better through her example. Catherine is also very humble and maintains positive peer relations and an optimistic attitude. She was determined to be a good student and a role model for others, as her own mother was for her during her childhood. We, the nursing faculty, wish Catherine the best in her future career. We have no doubt that she will achieve the highest degrees in this field, and we hope she can pass on her knowledge to future students in nursing.
Catherine. Yeah.
Our second award goes to Katie Hughes for her clinical excellence. Here is what her clinical instructors say about Katie. Katie started this program with no healthcare experience. She had her first experience with real live patients at Encompass in her first semester. From there, she has moved on to having med-surg, neuro, OB, L&D, and mental health clinical experiences. She's been at Encompass, Martha Jefferson, and UVA for clinicals. Katie had the drive and the initiative to participate in the RN externship program last summer at UVA 5 Central and 4 Central. That's quite an impressive path to take, having started with no experience. Katie has done well with doing all this while caring for her children, 3 dogs, 1 cat, 4 donkeys, and 3 horses. Okay. She has excelled in her didactic and lab courses, her clinical courses, and has connected and fostered relationships with her nursing school peers. I think anyone would have a difficult time saying anything bad about Katie. She's been a wonderful student throughout, and we have no doubts that she will be a wonderful graduate RN in the NICU at UVA. Congratulations, both to Katie and Catherine. Nice job.
Thank you, Kathy. Congratulations. Yeah.
Our next award is the Spirit of Nursing, or the Nightingale Award. What does a modern day Nightingale look like in 2023? How do we define one? No longer does a woman waiting on a thankful soldier while disinfecting the place fit the full description of a Nightingale nurse. Nursing is the art of caring, and yes, caring for our patients is still at the forefront of our ideals. Right now, there is a crisis in healthcare. Never had nurses had to face the challenges these new graduates will endure. One of the hardest things to handle in modern day nursing is the incivility they may face. The climate of the world has changed, and no longer are nurses met with grateful patients and families when struck in a crisis. The incivility they face can be overwhelming. So what do we nurses do? We as nurses need to enlarge our definition of the art of caring. The people we need to care about should not just be our patients. We need to include our fellow healthcare workers and ourselves if we are to continue to do our good work in the community. Who embodies the modern description of a Nightingale nurse? Well, I am so happy to say we saw one of those graduates exhibit these behaviors in practice. Here is what the professors say about this student. The future nurse I'm referring to showed excellent clinical judgment, asked smart questions, and provided fantastic individualized patient care. This person was always helping fellow classmates and staff with patients that were not on his assignment, demonstrating excellent teamwork. There was a day on the unit where there were a few difficult and behaviorally challenged patients. One particular patient seemed to be more aggressive than normal. The patient had entered the hallway intermittently and was yelling at staff, then returning to their room. When discussing medications with this student, we observed the patient corner a smaller woman who was the unit social worker. This future nurse walked over and just stood next to her. The patient told him in very colorful language that he did not want him there interfering with his conversation. The future nurse stood his ground and said, "I can see she is uncomfortable and backed against a wall. I am going to stay out of your conversation, but I will be standing here for her." The patient had a few more choice things to say, but then moved on. I had to talk to the student about how to call security if a problem escalated and talk about protocol, but all I really wanted to say was thank you for caring. That woman came up to me after to show me how much she appreciated that, and that it was wonderful, wonderfully unexpected from a student. This person rose above the old definition of a Nightingale nurse and truly embodied all the attributes of this modern definition. I want to thank this person as a nurse, an educator, and as a fellow citizen for his ability to translate the art of caring into practice. Seth Golkar. You are our modern Nightingale nurse.
Congratulations, Seth. Thank you so much. For huggers. Thank you.
Hey everybody, my name is Tammy Zanzel. I had the privilege of getting to teach all of these wonderful nurses this last semester. The next thing we're going to do is the nursing pledge. This pledge is on the back of your pamphlet. It's listed as International Nursing Pledge, and I invite every nurse and graduating nursing student to read this with me. Yes, please stand. I don't have control. In fellowship with the nurses here joined, with respect and gratitude for those who have served before me, and in faith with those who will follow, I make these promises. I commit to nursing as a healing profession. I will use the science and art of nursing to improve functioning, alleviate suffering,
and promote wholeness and the integrity of being, whether cure is anticipated or not. I will honor the nurse-patient relationship as the locus for healing and enter into it unreservedly while maintaining boundaries that respect privacy and foster trust. I will maintain the ethical principles of beneficence, non-maleficence, fidelity, and veracity regarding the patient's right to autonomy and seeking justice for all in my care. I claim the same duties and rights for myself as a condition of our common humanity. I will collaborate with all team members to deliver the highest quality care possible, assuming and delegating tasks responsibly, observing, assessing, and evaluating the patient's response in order to guide and revise the plan of care. I will use technology mindfully, never forgetting that I am the primary and ultimate vehicle for assuring the patient's safety. I will protect planet Earth as our home, knowing that fresh air, clean water, sunlight, nutritious food, and companionship are the birthright of all and essential to the maintenance of our collective and individual health. I will work for social justice and equity, building systems that support disparities and structural inequalities, and seeking to identify and eliminate my own implicit biases. I will endeavor to mentor even as I continue to learn, to grow, and to share in the advancement of the profession I love. And I will hold hope for the future. Above all, I will heed the nomination of our sister, Florence Nightingale. Live life while you have it. Life is a splendid gift. There is nothing small about it. Thank you, guys. I would like to take a moment to recognize and thank our Associate Dean of Nursing, Linda Plefier, which I just butchered. Linda LPF, everyone, from all the staff here. For those who didn't know, Linda will be retiring this summer. Linda came to PVCC at a time of great need and worked tirelessly in many roles that were not in her job description. I often saw her on the phone acting as an HR talent acquisition specialist, trying to recruit great nurses to teach for PVCC. Her excitement and passion were contagious. She brought in a lot of great people to help these wonderful students get the hours and instructors that they needed to get to today's joyous occasion. Linda, we thank you for your service to this community college, these students, and the nursing staff. We wish you the very best in the future.
Wow, that was nice. Okay, for closing, I'd be remiss if I didn't mention a couple things. Study for the NCLEX. You have about minimally 3 weeks until you can register, unless somebody's already registered and I didn't know about it. So use this time. Study groups, whatever's worked for you in the past, okay? And evidence does show the sooner you test, the better your score will be, okay? Had to mention that, okay? Because it doesn't stop here. And neither does the learning or the formal education. Most of you will go on to get your BS and Bachelor of Science in Nursing. I'm supporting and I'm suggesting and recommending many of you, because you're so bright, to continue on after that bachelor's. Get a master's, get that nurse practitioner, get that doctor of nursing practice, PhD. Don't stop learning, formally and informally. And again, we've been over this. The day you think you know it all is the day you might as well hang it up, right, nurses? Because that means you're not safe. Ask questions, always. Hey, does this look right to you? Get that second opinion. You will learn, and it will save lives. Please consider returning to PVCC, not just to say hello, but to teach. We're always looking for adjunct faculty, especially in your specialties, NICU, STBICU, Med-Surg. Please, come back and teach. Show more, pass it on, show more what you've learned. And I did this last year, so forgive me for those who were here last year, but I really like this song called My Wish by Rascal Flatts. This is for, yes, it's wonderful. So I hope the days come easy and the moments pass slow, and each road leads you where you want to go. And if you're faced with a choice and you have to choose, I hope you choose the one that means the most to you. And if one door opens to another door closed, you guys already know this, I hope you keep on walking till you find the window. If it's cold outside, show the world the warmth of your smile. But more than anything, our wish for you is that this life becomes all that you want it to. Your dreams stay big. You guys singing with me? Your worries stay small, and you never need to carry more than you can hold. And while you're out there getting where you're getting to, I hope you know we're very proud of you. Congratulations.